Okay. Okay. Hi everyone. Good morning. Good morning. Good morning. Thank you for joining me here. Eric was having some challenges, so I had to quickly join this page. So Eric is here. Yeah. Eric is here. Just a minute. Good morning, everyone. Thank you for joining. And today we are going to talk about breast health and say a big thank you to everyone who has joined us from all over the world. Eric, can you send a request, please? I want to say a huge thank you. So Eric is here, and yeah. So Eric, can you if you can hear me, can you send a request to join just so that I add you on? Thank you so much. Thank you, Lily. Thank you everyone who has joined on this page. I'm so happy to have you here. It's that time of the year that we need to have very candid conversations on breast health, and I'm happy to do this with Eric. Okay, so Eric is here. Right. Thank you so much. Eric is here. Thank you so much for taking time off your busy schedule to join me. Hello, Eric.
Hi, can you hear me?
Yeah, but your video is blank. I don't see your face.
Um,
Are you able to work that out?
Let me see. I'm having difficulty, but I'll sort it out soon.
Okay. So, Eric, I want to say a big thank you. I'm getting some feedback. I'm not too sure if it's from your end. Okay, very good. Or from my end. Okay, right. Eric, thank you for joining us.
You're welcome.
Yeah, so it's it's always about women's mental health and women's health as well. And I want to say a huge thank you, very big thank you for taking the time off your busy schedule to join us this morning. Okay, so it's that time of the year, and this is the 6th month of the year, and I'm thinking that if there's any good time to talk about breast health, I think this is really the time. Can you give us a very brief definition of breast health for women? When we talk about breast health, essentially what comes to mind?
Thank you very much, and thanks also for having me this morning. When we talk of breast health, health is health. I mean, health comprises the whole aspect of the what is in question. So in this case, it's breast. And so breast health is holistically paying attention to the breast, knowing what is normal to the breast, and then also knowing what is abnormal, conducting the examination, and especially visiting your doctor. So you don't need to get sick or you don't need to detect anything abnormal in the breast before you visit a doctor. So it's that holistic
Right.
towards.
Yeah, Eric, there was a bit of an interruption. Can you repeat the last line, please?
Okay, sure. So I'm saying that breast health is the holistic approach in paying attention to the breast, ranging from knowing what is normal, what is abnormal, and visiting a doctor. You don't need to detect any abnormality in the breast before you visit. So breast health is the holistic approach that is used to taking care of the breast.
Okay. Eric, thank you very much for that submission. You know very well we are taught about everything, especially. So, Eric, I'm getting some feedback. I don't know if it's from my end or from your end. Can you check that out?
Okay, sure.
Oh,
Let me.
right. So, I'm happy that you talked about a holistic approach, and just to take your mind down to socialization, how we are brought up as women. We are
Just
taught everything. Okay. Okay, so Eric is going to work on his audio, but I'll keep talking as we wait for him. I think it's very important to check our breast
is it
health. Okay,
is it
Eric is
better?
back.
Is the sound
Yes,
better now?
yes,
Sure.
please. Eric,
Okay,
thank you.
thank you.
So my question was that you talk. No, it's still giving feedback.
Oh,
Eric
then
is still
I
giving feedback.
okay. Let me
Okay,
discontinue this and see if it will work.
okay. Maybe use the normal audio and let's see. The normal phone audio and let's see if it will work. Yeah, it's better. It's
Okay, sure,
better.
sure.
Okay. So Eric, you talked about a holistic approach and being able to determine the normality from the abnormality. And on that note, I wanted to add that, as women, we are taught everything. I mean, we teach our girl child everything about care, taking care of the environment, taking care of themselves and washing and all that, but there's nothing so particular about breast care. And so when you talk about holistic care, I wanted to ask you what you had in mind when you talk about holistic care. I say that on the premise that with most of the cases that you and I have encountered around breast health, there's so much ignorance about the breast, ignorance about the body, ignorance about changes. How does this conversation, changes in the breast area, how does this conversation feed into the mainstream conversation on breast health? I don't know if
Okay.
it makes sense.
Yeah, yeah. So yes, mostly, when we talk of breast health, our attention
Right,
just goes to breast cancer. Uh, not getting breast cancer means breast health, but it goes beyond that. In fact,
right,
breast comes in so many shapes, so many sizes, and also changes from adolescent to menopause. And so
right.
when you notice these changes, some can be normal, some can be abnormal. And
Okay.
so when we come, probably we'll be looking at lumps, we'll be looking at cysts, mastitis, or even painful breast.
Right.
When you detect all this, it means that probably there's something wrong. However, it could also be that that is the normal way your breast looks like. And so let's look at 5 ways of treating the breast, or 5 ways of good breast health. So we want to
Right.
talk about the skin of the breast. In fact, the skin of the breast shouldn't be different from the skin of the body. So when you
Right.
realize that the skin is probably deviating from the normal, then probably you should know that there's something wrong. And the temperature as well. Temperature of the body should be equal to the temperature of the breast. So when you realize that you touch the breast and it's a bit warm, a bit different or from the body temperature, then it may be that there's something wrong. In fact, when the breast, touch warm, it means that it could be an infection somewhere. So you need
Okay.
to check about it. And then also
Right.
discharge. The breast shouldn't discharge ideally. So if you see any
Right.
discharge, breastfeeding, you are not pregnant, and you see any discharge at all, it means it
Right.
calls for cause. And then you should also be pain-free. It shouldn't be painful. And the exception to this, at times during menstruation, you may feel some pains here and there. That's okay. But when the pain becomes intense, even after menstruation, then it's not normal. And then
Right.
obviously, when you see a lump in the breast, not all lumps are cancerous. In fact, studies also say there are normal lumps in the breast. So when you
Right.
see any lump, just feel free. But then if the lump is in your breast for a very long time and it's not causing any harm, probably it's not harmful. So there is no cause for alarm. So these are the 5 signs that we can, or 5 signs that will indicate that our breast is in good health.
Right. Temperature. This is the first time I'm hearing about temperature, Eric.
Yeah.
So can you expand a little bit more about temperature? Is it the room temperature or the temperature of the body? I mean, it comes across as very interesting for me. If you can just throw a bit of light on it, please.
Sure. Okay, so the breast is part of the body. And so how you feel should not be different from the breast. But there are cases where when you touch the breast, the temperature there may be different from, let's say, on your neck or on your chest or on your hand. That means that there's something wrong. An infection of the breast can cause a very high temperature. You touch the breast, you see it to be warm. That warm, different from the body temperature, means that there's something wrong. So generally, the body temperature, the general body temperature should be equal to the temperature of the breast when it's touched. I don't know if it's clear.
Yeah.
Good.
Yeah. That's a good submission. That's a very good submission. Thank you, Eric. Eric, I know you are one of the trusted experts in this field. I mean, you're a man in a women-oriented healthcare service. I mean, if I say women-oriented, essentially, there's this perception that breast care is just women-centered. There's not much about men's breast health. And I know that we understand the physiological differences of it. But in reality, we know that we can talk about women's breast health and also talk about men's breast health. Are there any similarities? Are there any differences, especially for mothers, for women who are looking to not just educating themselves, but I mean, opening the conversation on breast health in a broader way that allows us to save our men and our women? And as we know, there are cases around breast cancer being centered on men as well. So, I mean, this is just to throw it at you from a man's perspective. What do you have to say about that?
Okay, so the only difference between the female breast and that of the men is that the female breast is being controlled by hormones, largely the estrogen and the progesterone. But with the men, there's no hormone controlling that. And with the female breast, there are a lot of fatty tissues, and there are a lot of lobes and lobos and ducts just to provide milk for the infant. But with the men, we don't have that. Nevertheless, the men can also develop breast cancer because there are cells in our breast as well. And cancer is just the abnormality of a cell. So wherever there is a cell, cancer can occur. So we men also have cells in our breast. So one of the cells can decide to misbehave, forming a cancer. The same way the women also have cells in their breast. And one can also decide to misbehave and then forms a cancer. So basically, the female breasts are bigger, way far bigger than that of the men because of the hormonal activities and the functions it performs compared to that of the men. We don't have our breasts don't have any particular function per se, but the women's breasts have a lot of productive functions, and that's the difference there.
Right. Eric, thank you for that submission. What will be the routine for a normal breast health examination for any woman out there who is health conscious and very mindful of breast health? What will be the routine health check for them, personal and even on a broader health basis?
Okay. All right. So what happened is that there goes a saying that men know thyself. So women also know your breast. Knowing your breast will let you detect any abnormality very early. You can't compare yourself to another woman. Probably when she's menstruating, it's a full pain. You don't. So therefore you cannot compare. But then you can always treat the breast very well. What are some of the points
Right.
that let you treat the breast very well? We need to wear supportive braziers. I mean, the correct size of our brazier. Nowadays, you see our young women, they'll be pumping the breast with very small size of a brazier with a very big breast. You are just constricting the vessels in the breast. And so the vessel also carry blood, to and fro. So when you constrict it, the movement of blood will not be patent. Yeah, so we should put on the right size of our brazier. And also when you put that tight brazier, there are nerves also supplying the breast. You are also inhibiting these nerves from performing its functions, and at the end of the day, they will bring pain. Again, we need to avoid putting on weight. We need to avoid putting on weight because this have effect, or obesity have effect on the breast. Now, what happens here is that when you put on weight, there's an excess of fat, okay? And this fat, when the body does not need it, will convert this fat into estrogen. Now, the body have enough estrogen already to work. So if you put on weight, a lot of fat, and the body converts this fat into estrogen, you are just fueling the cell. It means that the cell does not need that much of estrogen, but there is more. The cell can just misbehave on that account. We can also waxing the nipple hair. As you see women spending time with their nipple, removing all sorts of particles from there. It's not healthy. We need to stop that. The nipple has its own way of, bringing out what is not needed. It's a natural way of removing the debris. So it will remove by itself. You don't need to spend time on it, removing it. And then also nipple piercing is also another issue. You don't need to pierce the nipple because the nipple is very sensitive and they are made up of cells and nerves. When you pierce it, it becomes something else and it may also disturb you some time to come. And then also not having brazier at all is also not good. You need to support the breast. If you leave it like that, the cells will just be, we need to support the cell. We need to package it well. So we need to wear the right brazier. And these are some of the ways of treating the breast very well.
Right. Eric, I have a question for you. Okay, so someone is asking if it's normal to experience breast pains during menstruation. And I think I'm missing the other part of the question. But is it normal to experience breast pain during ovulation or menstruation? And what's the normality? Breast pains during ovulation or menstruation, and what's the normality and abnormality of it? And when can a woman say that there's a problem, essentially? Sometimes it's a bit blurry in there and you're not too sure if it's a problem or not.
Yeah. So the point here is that, again, you need to know how your breast look like. Some may experience pain during menstruation or ovulation. That is okay. After that, it goes away. Then you are free. Some also, after that, it persists. And that is where the problem is. So you know that during menstruation, at the third or fourth day, fifth day, I feel this pain. I feel this sharp pain. My breast become engorged. That is okay. That is normal by you. So after some days, you are done with the menstruation. This pain should go. But if the pain persists, then it means that there is problem. Others also don't feel the pain. They feel some bit of discomfort, bit of engorgement. The breast becomes bigger a bit. These are hormonal activities that are taking place. So that is okay. But if it's becoming too obvious, becoming too big, this is not normal. This is not how my breast used to be. But now it's becoming something else. Then it means that we need to pay attention to it. So on a whole, what we can say is that please know your breast, know the size, know the texture, know the skin, know the nipple. Because at times they don't really pay attention to the nipple. When the nipple is even retracting, they may not even see it. You understand? Some nipples are normal, some nipples are inverted, they are in. That is okay, that's normal, but others are not. So the
So
point here is that
inverted, Eric, inverted means inside. The
yes,
nipple is not
inverted,
turned outside. It's actually
exactly.
coiling in
Inside.
inside.
Exactly.
Right,
Exactly. So the cancer can also pull the nipple like that. It
right,
can pull. That's what I'm saying, that know how your breast look like, so that in case you detect that no, my nipple is pulling in, it's just going in like that. This is not normal for me. Some are born
right,
with that. That is okay. So the
right.
point here again is that let us know how our breast look like, so that we can take prompt action when there's any abnormality.
Eric, what if the pain is before menstruation? What if premenstrual syndrome? Sometimes women also have some experiences of the sort. What if it's before menstruation? Is there a cause for concern?
Okay, so not really. You know, during menstruation, a whole lot of physiological activities takes place in the body. So
Yeah.
you may feel the pain prior to menstruation, some few days to menstruation, just prompting you that you are coming to have this activity. The body is going through this kind of physiological activity. So that is okay. But the point here is that the pain shouldn't be unbearable.
Right.
The pain that you experience shouldn't be unbearable. If it's coming too severe to the point that you can't even put on brazier, you can't even touch the breast, then there must be something wrong that we need to investigate. But if it's this mild pain that you can bear, that is okay. And after the menstruation, it goes off. So
Right.
before, during, and after menstruation, you can experience this mild pain. That is okay. If that is how it is, others also may not experience it, but going forward, they'll start experiencing that. That is also okay. It means that it did not start early. But as we grow, a lot of things changes in our body. The cells change, hormonal activity and others also change. So we should just study it and see if it's normal with us or it's not normal with us.
Absolutely. Absolutely. Thank you so much for that submission. I hope that answers your question. Please, if you have any questions, Eric is here to help us address them. Or Eric, when we talk about breast health, do we have to segregate the conversation? Because my breast disorder started with motherhood, breastfeeding and all that. So I'm thinking that when we talk about the conversation on breast health, do we need to segregate it? Do we need to talk about breast health among adolescents, breast health among women within childbearing years, breast health among women within menopause, breast health post-menopause? Would it be important from your experiential view to say that we need to segregate the conversation on I was going to say mental health, on breast health, so that I'm thinking that in very neat specific way we can ask women to pay attention to breast health based on the milestone development that define the specific or specified milestone development that they find themselves in. Would it be an exaggeration, or you think that?
No, that's okay. So the point here is that I think we did a study some time back where we went to maternity home to screen the women of any breast abnormality, and we realized that most of these women were having cancer, but they didn't know.
Hey,
I mean, what
wow.
I saw the changes, but I thought because I'm pregnant, that's why the changes was like that. But most of them that we screened were probably developing cancer. So the
Wow.
conversation shouldn't be limited to as in adolescents, those going to menopause. No, it should go beyond that. We need to start thinking on a broader picture, as in
Right.
woman at all can be screened. Because, well, I understand the point of view from the woman. Because, I mean, when you get pregnant, breast change, you know, so mostly they sort of, because I'm pregnant. And by the time they go through the pregnancy stages of 9 months, the cancer would have moved from a stage to far advanced. And that is where the issue is. In fact, we have women that are seeking treatment that, saw the cancer after delivery. After delivery, they realized that what was happening was not going, even after delivery. Then they sought help and realized that, there was something wrong with their breast. So I agree with you perfectly. It's not an exaggeration at all. We need to have a broader picture of what breast cancer is and not even wait to, detect a lump before we come to. We should always walk in there. We should always check whether pregnant or not. The health personnel will be in the best position to tell you when you are pregnant whether the breast looks normal or not through examination, various investigations. So yeah, we shouldn't wait to say that, oh, that is how it is when I deliver it will go. No, let's do further investigation to see if there's something wrong.
Eric, I'm so excited about that submission, especially on the point that surprisingly, breast cancer continues to be the most common kind of cancers among pregnant women. That knowledge of it just gets me worried and very concerned, and it kind of urges me to do more in terms of, speaking out on the conversation on health for women. If you have any further questions, please, Eric is here. Let him answer it quickly. He's a very busy man before he, leaves us today. So I'm very happy that you reiterated that point. I think that's so important. I think my next question would be that you've been in this field for more than 10 years, and I think women in Ghana should be applauding you for that. What is the one thing that you think that women tend to overlook in all these years that you've been around? What is the one thing, especially with cases among women, that we tend to take for granted?
Okay, so based on experience and based on the interaction that I mostly have with my clients, I think they are doing well on the whole. Now they are coming, and that is fine. And probably that also accounts for the reason why the number is going up, because now women are more aware of the situation and now coming to hospital. But then I think what they are probably ignoring is the fact that they don't really have time for themselves, especially when it comes to breast examination, when it comes to paying attention, because most of them comes and they even attribute the detection to their husbands. It was my husband who saw it. My husband told me that, this is not the breast, and this is very encouraging. It means that the men are also paying attention to their property and protecting their territory. That is really fine. So yes, we should pay attention as women. We should pay attention. Women pay attention more, on their face, makeup. In fact, if she's going out and she doesn't have mirror, she will not go out, because you need to see that she's looking fine.
You can't blame us, Eric. You can't blame us.
I understand. So in as much as we pay much attention to our face, we should also pay attention to the other part of the body, most especially the breast, because the breast is really, really causing harm, and we need to do something about it. So you seeing it early, the best preventive measure. We shouldn't ignore. We should try constantly, at least every day, through the breast, see how it looks like. Has it changed? Did the same as it was yesterday, or it has? Yeah. So we need to really do that. And I also commend the men for that great job that they should continue detecting, should continue helping our women to detect inabnormal things.
Absolutely. Absolutely. I always say that if the conversation on breast health is, externalized to everyone among us, then it helps to fight the disorder, and education seeps down in a very better way as well. Okay, so Eric, thank you for that submission as well. I mean, we spend, as we spend a lot of time on our face and all that. So by extension, you are just saying that the mirror should also go to the breast area as well, and we should spend time having a good reflection on what's going on around our breast area. So want to say a huge thank you. I always say that any woman with I say that a woman with sound mental health would obviously pay more attention to her body. And we know that in you also have a psychiatric background. So when I talk to you about breast health and mental health, I'm so excited, because then we appreciate the role of mental health in breast health. And we see physical health as a very dominant aspect of mental health. And so obviously we can't rule out the importance of it. So I always would want to emphasize that as a sound, mentally healthy woman would also have a good breast health as well, because definitely means that you are listening to your body and you are paying attention to some of the clues that your body is communicating to you, and you're empowered to take the right decisions. Eric, today you didn't talk about nutrition in breast health.
I knew you would definitely get it.
Before you go off, I'd really be happy if you would talk about nutrition in breast health, because I feel that women would do everything to look good. We'll buy the pawns for our face, the makeup and all that. Now we know the pills that even would give us very healthy skin looking shine. What should women, in very 2 or 3 lines, what would you encourage women to eat to have very good breast health?
Okay, so I think this question will be incorporated into ways of improving breast health. Breast health. And so the first one I want to talk about is exercise. Exercise is very, very important. In fact, exercise builds the immune function. It also reduces weight. We talk about obesity and breast cancer. So exercise also reduces the weight, thereby reducing your risk of getting breast cancer. And then also it lowers the level of estrogen. I mentioned that there are enough estrogen in women already. And so if you exercise, it reduces this estrogen as well. It also improves the bone mass. Essentially, what happens is that when you're on chemotherapy, it's a systemic medication, so it goes to every part of your body. So anybody on chemotherapy have this bone suppression, sort of. So exercise will improve the bone mass, and then it will really help the body to go through the treatment very well. And so let's then come back to the diet that you mentioned. Yes, in fact, in Ghana, we are so blessed with our food that we eat, the veggies and then the fruit. So you realize that the fruit and the vegetables we should continue eating. It makes the body look fresh. It excites the cells, it gives the cells a healthy, functional activity. So our fruits, our vegetables, we should continue. Our garbage and the whole grains are also important source of fighting cancer, and so they act as anti-cancer food as well. Then we should also reduce our alcohol intake. we should reduce our alcohol intake. In fact, for women, if possible, we should try as much as possible to abstain from alcohol. Because what happens is that alcohol, the liver works on the estrogen hormone. And when you take in alcohol, too much of alcohol damages the functions and limit the functions of the liver.
Right.
So when the function is reduced, it means that it can no longer act on the estrogen, and then possibly breast cancer may ensue. And so we should reduce our alcohol intake. We should also reduce our fat intake. In fact, we should increase our vitamin D intake, which essentially we get from sunlight. Not the hot afternoon, but the mid-morning sunlight is very good source of vitamin D. And also we can take vitamin D3 supplement as well to boost our system. So essentially, I cannot prescribe food to eat and food not to eat. But what I will say is that in everything, there should be a moderation. We should eat moderately. If it's red meat, we should take it moderately. Not that you take it so much meat, or every day we take in meat, no. Or we taking so much milk, no. But we should take everything in moderation. In that we should not consume too much of everything, no. And let's come back to our food, our contumely, our garden eggs, our garlic, our ginger. Let's come back to those foods and suspend the pizzas and the so to speak, the white man's food. Now because of no time for anyone, we eat more of outside. But let's try as much as possible to cook at home and then prepare the food to suit our taste, rather than going to buy from outside where they are prepared due to how they want to prepare it. No. So let's forward the body, let's keep the body healthy, let's exercise, let's visit hospital regularly. You don't need to get sick before you visit the hospital. And when we do all this, we'll realize that we'll give a very good health to our breast.
Eric, thank you. Thank you so much. Okay, so someone is commenting. Okay, someone commented that so you asked women to stop alcohol intake, and someone was asking even red or white wine. I think the key word is moderation, right? Or you want women to stop. Come again?
Yeah, the key, I can hardly hear you.
Yeah, Eric, can you hear me?
From far.
Okay, so the key word is moderation, right?
The key word is moderation.
Yes, so you can have your red wine or white wine, but moderation. And if you can stop all together just to protect yourself as well, I think that would be great. And if you have any question, please, you can just put it in the chat. I'll just ask Eric quickly. He has to leave in any minute from now. So if you have any quick question you'd want to ask Eric, please ask him. Eric, what are your social media handles?
Facebook is Billy Grobe. Instagram is Billy_.
Okay, so if people are interested in contacting you, how do they do that?
Well, I don't mind putting my contact out.
Okay, so you can do that.
Yeah, so you can reach him on 0570 691681. 0570 691681.
Okay, so Eric is with the breast clinic at our very own Korle Bu Teaching Hospital. I think it's very important to also emphasize that if you have breast health issues, please go to the breast clinic. Go to the breast clinic. They are specialized in breast health. We also realize that most of the GPs would miss out on early diagnosis. I've had women talk about early occurrence of breast cancer being treated as infections. If you check my YouTube videos, there was a recent interview I had with a breast cancer survivor where she talks about her breast disorder being diagnosed as an infection. And by the time it was realized, I mean, she was in stage 3. So please, if you have breast health issues, please see a breast health specialist. I think that would be very important to take note of.
Yeah, let me add this also that now you can just walk into Kolebu Medical Department and you'll be sorted out. You don't need a referral
Oh,
or coming to Kolebu.
wow.
Just walk into the medical department. The best nurses are at room 9. So just go there, just tell them what is wrong with you, and then they will screen you. And if there's anything, they will direct you as to what to do. So let's do that. It's very important because the
Right,
statistics are not good at all. Let's
right,
pay attention to breast cancer.
right, right. So just walk to the Kolebu Teaching Hospital, Eric, room 9, room
Yes, room
9,
9.
and
Yeah,
yeah, and
at
speak.
one floor of the medical department.
Come
When you
again.
get to the immediate left,
Yes, when you absolutely when you enter the immediate left, the surgical block, please let's take care of ourselves. Eric, I don't know if you have any notes for us before you leave. I'm hoping that I'll be able to catch up with you sometime early next month. And I know you'd always have something on breast health for us. If you can have time every week for us, I think that would be great. I know that
yeah,
you're already
sure.
in a life-saving mission. What will be your last notes for women in breast health and all that?
Okay, so what I would say is that breast cancer is real. Breast cancer is not any demonic disease. No, we should not attribute that as any demonic attack on anybody. As we eat, we get sick. And so when that happens, don't ask us, why me? Why me? Just take it like a normal sickness, like normal hypertension, normal diabetes, and talk to hospital. And then also follow all that we plan for you. Don't run away. Don't listen
Yeah,
to people. Most
yeah,
cases when you will die, you will die. But the question is, don't ask them you will die. Have you done it? Yes, why are you not dead? So
yeah.
whatever we hear, let's ask questions. We shouldn't run away. And if you have anybody going to breast cancer treatment, please support the person. Don't leave the person alone. Support the person.
Right.
Social support is very, very important when it comes to treating breast cancer. Support them.
Absolutely.
Get closer to them. It's not infectious. To get closer to
Absolutely.
them, give them all the support that they need, and they will get to you. If you not also like that is okay, but let's try to prevent it. The first treatment here is prevention. So let's put the preventive measures. Let's rest, let's exercise, let's eat, let's take care of our breast. And I know that we'll probably be speaking the language the next time, in terms of the statistics coming down and our women definitely also being reduced. Thank you so much for your time, and I know we're having a session of this regularly, at least
Thank you.
sensitize the
Thank
public
you
about
so
breast cancer
much.
and our
Thank
women
you.
as well. Thank you so much.
Thank you so much. Thank you. So I want to say a very big thank you to everyone who joined us. I can see Hopeful and Komo. Thank you so much. I can see Ifa. Thank you so much. I saw Lily Arms. Thank you. I think yeah, I saw her. Thank you so much as well. Thank you, Lucy. I saw you online as well. And everyone who watched later, I want to say a very huge thank you. Do follow us. We have more for you. Psycare _ consult on Instagram. On Facebook, we are there. Psycare consult. On Instagram, I'm also there. Dr. Otubia. Let's keep having this conversation and stay healthy. Eric, thank you. Thank you
You're
so much.
welcome.
Bye.
Bye bye.